Hello, Nurse Lauren.
Hello, Skye.
How are you? Tell us how it's going. You are an ER nurse in Manhattan dealing with COVID, and what'd you just do the last 5 night shifts in a row?
So basically, our entire ER is flooded with COVID patients. Um, we've kind of redesigned our emergency room to have three separate treatment areas. We have one area that is designated for the very sick COVID patients, the ones we're worried about, the ones that may need ventilators. Um, it's an area where there's mostly negative pressure rooms and that means that the air that they're breathing can't come outside of the room and infect other people. Then we have a second area that is for COVID overflow. Um, that's reserved for the less sick COVID patients. And then we have one other area that we are using to treat regular ER patients. So it's a new world for us.
So, what were these areas before they were all COVID central?
They were all just regular parts of the emergency room. You could get any type of patient in those areas.
Where are those patients going now?
There's only one bay. We call them bays. So we have a trauma bay, and that's where anybody with non-COVID related issues go.
Are any of these patients contracting it while they're in the hospital?
It's hard to say because testing takes over 12 hours. So I wouldn't be surprised if they are catching it while coming to the hospital. But we wouldn't know until probably a week after leaving. We're also the emergency room, so we don't follow through as much with the patients. Um, but I think there is a very good chance that they're probably catching it just by being there. We are trying to prevent that by every person who walks into the ER has to put a mask on, no matter what they're here for. And we've completely restricted all visitors. There are 0 visitors allowed in the ER, only patients, unless you are a minor, in which case one parent can be with you.
And then, how are nurses and doctors feeling about, contracting this? And how are you feeling about dealing with this?
I think we're all kind of in the same mindset. We all know we're going to get it, and it's kind of just a matter of when we're going to get it. We're doing everything we can to protect ourselves, but we all kind of feel like no matter what we do and what we're wearing, we're still surrounded by it for 12 hours straight, working inches from these patients. And we've already had a lot of staff who are out on quarantines, some of which have tested positive. Some are admitted to the hospital, some are at home healing. But I think we're all kind of scared. I mean, the more we work, the more patients we're seeing. Everybody's testing positive, and I think there's no way we're not going to get it.
Wow. That's scary if you're scared.
And you know me, I don't get scared, but we're seeing a lot of sick people across the spectrum. There's young people, old people. Uh, it can hit anybody.
How come they originally said that this really hits the older population or vulnerable populations? Why was that the message initially?
So, with any illness, the vulnerable, the elderly, they are more prone to uh, get the disease and not survive from it. I think that goes for any sort of virus. It's the same as with the flu. The elderly are more at risk. Um, it can hit the younger people, but at least I haven't seen anyone young without a pre-existing condition that's had a bad course. Um, but I think it's too early to tell. I think we're still gathering information on it. And we are seeing younger and younger people coming in and needing to be on a ventilator, and they're only in their 20s.
It's really scary. Are you administering the test? What is that test? So, what is the test to get tested? What does that mean?
The test is the same swab as a flu swab. So it's basically like a little cotton tip. It goes in both nostrils and it goes up really high. Like it almost feels like it's poking your brain. It's the same exact tube we use to test for the flu in the hospital. Um,
Wait, so the day, remember when I thought I had the flu and you told me to go get a flu test? That's the flu test?
Mm-hmm.
A long swab that goes up your
Yeah.
nose and into your brain.
Yeah.
Like when the Egyptians would mummify people, remember? They would have that hook and pull out the brain like that.
Yeah.
Wow. Both nostrils.
We do both nostrils. Yeah.
Wow. I've never had that test. Have you?
I have. When I got the flu this year, I had to get that test myself. And it's pretty brutal. It's uncomfortable, but it only is up there for a second and then it comes out.
How long of a straw is it that goes up there? Wow. Wow.
Yeah.
Okay, so how has your role changed now, Lauren, based on what you were doing in trauma in the emergency room and now? What has changed?
So we've added additional roles since this has all happened. We have implemented a screener nurse who basically stands at the entrance of the emergency department, and every single person who walks in, we're screening them for possible COVID related issues. And that way we can isolate quicker, get them out of the waiting rooms and into a negative pressure room. And then we also started a tent, which is in our ambulance bay, where originally it was made to bring in our well-looking COVID-related symptoms, but it's turned into just a regular urgent care to keep people with non-COVID issues out of the hospital. And we're staffing 2 nurses there.
And is there like a long line to get into that area?
There's actually not a long line. I think in the news it's saying that the hospitals are like overwhelmed in the emergency rooms. But to be honest, we're seeing lower numbers than we've seen in 10 years in the ERs. And I think that's because people are really scared to come in, which is good because we need all of our resources for these sick patients. Where we are getting overwhelmed is in the COVID treatment areas where we're having to gown and mask up for every single patient. It takes time. It takes, like 5 minutes to get completely ready just to go into these rooms. So it's been draining on nurses in those areas. But I mean, my role as a nurse inside of the ER when I'm taking care of patients is the same, just with more precautions.
And what, changing those clothes every time for every patient?
Mm-hmm.
Wow. So what do you think of converting like the Javits Center into a hospital, and there's talk of making some of these hotels into hospitals? Do you think that that's necessary, and what is that going to look like?
I think it is necessary in a place like New York City where we just have millions of people. I think we're just at the beginning of this. We're already seeing so many, and our ICUs are already getting overwhelmed. I think it's completely necessary. I'm not sure how they do it. I don't know if it's, maybe is it going to be the military that's setting up these hospitals?
That's who's doing it at the Javits Center. I don't know how they would do it for the hotels.
So, I mean, they're used to doing it in the field at wartime. So I think it's necessary. I don't know if they're going to be using it for the COVID patients or for regular patients. I'll be interested to see. And then we have the naval ship coming too.
Oh, yeah.
My dad's nurse from his office just got staffed on the naval ship.
Wow, how did she get that?
She's an ex-military nurse.
So what, they recruited those types of nurses?
So they're actually bringing in a lot of nurses from any nurse who works outpatient, works at doctor's offices. They're sending emails and they're bringing them into the hospital, whether or not they have like paperwork to work at these organizations. They're just bringing them in to have extra hands on deck.
Wow.
We have nurses coming in from neighboring hospitals straight to the ER just to help us. Wow. I do have a recommendation for those of your followers going out. While the mask is good and the mask is something that can really protect yourself, Do not wear gloves outside. People are wearing plastic hospital gloves outside. You're basically holding those germs, those bacteria on your gloves. And if you don't take those gloves off properly, you're exposing yourself even more to the virus.
Really?
Even though you're blocking your hands while you're wearing them, think about it. Those latex gloves, everything lives on that. You're better off just wearing your mask and washing your hands frequently.
Wow.